Coronavirus infections in the U.S. are continuing to fall. The downward trend comes as experts warn of a possible twindemic this winter. They say it's because pandemic precautions that kept both the coronavirus and the flu at bay are not as prevalent now. Meanwhile, Texas Governor Greg Abbott issued an executive order Monday prohibiting vaccine mandates in the state as health experts urge Americans to roll up their sleeves. And the U.S. could soon have the world's first pill to treat the coronavirus. Here's Manuel Bojorquez with the details.
Tonight, the drug maker Merck may be a step closer to distributing the first COVID-19 treatment in a pill. The company is asking the Food and Drug Administration for an emergency use authorization for the oral treatment targeted to unvaccinated people who have developed COVID symptoms. Merck says early trials show the pill cut hospitalizations and deaths by about half. Meanwhile, Dr. Anthony Fauci says kids can safely enjoy Halloween this year.
You're outdoors for the most part, at least when my children were out there doing trick-or-treating, and enjoy it.
But there is continued concern about COVID during pregnancy. Only a third of pregnant women in the U.S. are fully vaccinated, and new studies show expectant mothers with COVID-19 symptoms risk complications, such as gestational diabetes, and their babies are more likely to be admitted to the ICU. Dr. An Nguyen is an ER physician in Houston who treats COVID patients.
Tens of thousands of pregnant women have been vaccinated. I personally have not seen any bad outcomes from vaccination, but I have seen tons of bad outcomes from pregnant women with COVID.
She's 36 weeks pregnant herself, expecting her second child, and has just received a booster of the Pfizer vaccine.
This is like a golden opportunity to give my baby the antibodies. I don't anticipate that my newborn would be eligible to get the vaccine, and so she's going to get the antibodies that are circulating in my blood from me getting the booster shot.
There is evidence of that. One study found 100% of babies born to women who received the Pfizer or Moderna shots also had the antibodies triggered by those vaccines. Elaine?
Manuel Bojorquez, thank you. Dr. Andrew Bazemore joins me now. He's a family medicine physician and the Senior Vice President of Research and Policy at the American Board of Family Medicine. Doctor, welcome. Thanks very much for being with us. So experts are warning of a so-called twindemic of the flu and the coronavirus this year. How concerned are you, doctor, about this, and who would be the most vulnerable?
Thanks so much for having me, Elaine. We are concerned. I will say that last year's flu season was particularly mild. We were all, for the most part, at least in my area, trying to mask up as much as we could. Models are saying that we don't anticipate another COVID surge in the wake of Delta this winter. Boy, if we know anything about COVID, it's been pretty unpredictable so far. So I think we're planning for the worst, hoping for the best, but we do know that flu is likely to bounce back as more folks are heading indoors and resuming some components of their normal lives. And we also know that our hospital systems continue to feel a real crush of COVID and a lot of burnout in their staff.
Well, former FDA Commissioner Dr. Scott Gottlieb says it's certainly reasonable some kids aged 5 to 11 could be fully vaccinated by Thanksgiving. That's about 6 weeks away. Remind us, doctor, what needs to happen between now and then?
So I think that continuing to mask up and listen to the advice that's rendered by experts like Dr. Fauci and the CDC are particularly important. It's tempting in times like these to let our guard down. We know that the cold weather is going to be pushing more and more of us indoors. The ability to get to this pediatric vaccine is going to be remarkable, but it doesn't change the fact that COVID is still with us, and we haven't gotten through the process yet. We've not gotten to the point of actual approvals.
Well, according to a new CBS News poll, 35% of parents say they will not get their children vaccinated, 37% say they will, and 26% are unsure. Doctor, what do you make of this, and what's your message to parents?
We know what we know about the coronavirus, and we know what we know about the vaccines. And choosing between the two, the vaccines have proven safe. I have faith that this is going to be a thorough review process, as all have in the past. And I know that there's been tremendous, mixed opinions about the vaccines, to say the least. I would listen to your primary care physicians This is the largest, most widely distributed of the healthcare delivery system, and this is really where you can go for advice on your vaccine. So I would recommend listening to your pediatricians, your family physicians, and watching what they have to say as they interpret and help you to interpret the news coming out through this approval process.
Well, Dr. Anthony Fauci says children can, quote, get out there and enjoy Halloween this year. What's your advice to parents with young children?
Well, obviously, I wouldn't say we're back to 2019. We should still take precautions this Halloween, particularly if your children are too young to be vaccinated or haven't been vaccinated at this point. I believe that it's probably better to set up as much as we can, weather permitting, outdoors, continuing to put candies in a kid's basket rather than having them reach in large bowls, and keeping hand sanitizer available where possible. I happen to have teenagers who've been vaccinated, and it's a reminder to me that Halloween remains the fourth highest number of ER visits, fourth highest night for the number of ER visits in the country. We continue to see other injuries and burns and car accidents, but I'd continue to encourage folks to follow safe hand washing and mask wearing precautions where possible.
Well, drug maker Merck has asked the FDA for emergency authorization of its pill to treat coronavirus. Doctor, what do we know about how this pill works, and how much of a game changer could it be potentially in the fight against the pandemic?
We obviously need antiviral treatments like this because COVID-19 is here to stay for the foreseeable future. And just imagining as a primary care physician the power of an oral outpatient medication, such as molnupiravir, it would be a remarkable game changer. It could dramatically reduce the number of patients that need to be admitted to receive treatments, and it could really change the course of pandemic in almost every country. I would make sure to emphasize that this does not replace vaccinations. We have to have both prevention and treatment if we're going to get out of this. So if you can imagine the vaccine as really your raincoat and your mask as your umbrella and boots, these are better together. And imagine the antiviral treatment as the towel you're using to dry off when you get home. It's not an even trade for the vaccine. We have to have both. And I would, again, continue to say we're going to need to mask up, wash hands, and keep our distance, and stay in touch with your primary care physicians.
All right, Dr. Andrew Bazemore, thanks very much for sharing your insight and expertise with us.
Thank you so much for having me, Elaine.